Ladies, there's a class of medication that's changing the conversation around menopause, metabolic dysfunction, and stubborn menopausal weight gain. Today, I'm talking about GLP-1 therapy for menopausal women. Because the reality is that women gain weight during the menopause transition, regardless of a healthy and active lifestyle. We explored the main reason for this in video 3 and 5, but today we're talking about one clinical option that may help address it. I've navigated this dilemma personally, and I want to be honest about that. For me, a GLP-1 was a last resort, and it turned out to be the best viable treatment to correct my menopausal weight gain and restore me to a healthy weight while also improving all of my metabolic markers. My GLP-1 helped me restore my health. I experienced meaningful results, and I want to share information that can help you objectively consider your clinical options. So stay with me to the end because I'm going to show you what GLP-1s can do, what they can't do, and what you should know before deciding whether this is right for you. Let's talk about it. Hi, I'm Kathy Bracken, and welcome back to my channel. If you're new here, welcome. I appreciate each and every one of you taking time to drop by and hang out with me for a bit. Don't forget to subscribe, tap that notification bell, and give the video a thumbs up. Your support this way allows me to continue creating my unique brand of self-improvement content aimed at educating, empowering, and inspiring positive transformation in you, the viewer. This is video 6 in our Menopause and Metabolic Health series, and today we're talking about GLP-1s for menopausal women. In video 5, we discuss metabolic dysfunction, the cluster of biological disruptions that menopause can drive, and how to recognize some of the symptoms. Today, I want to talk about one clinical tool that may help you address some of that dysfunction. My role here is that of an educator. I'm not here to diagnose any conditions or tell you what treatment is right for your body. That decision belongs between you and a qualified medical professional. I've experienced the benefits of GLP-1 therapy personally. I lost more than 50 pounds in 6 months with the help of Tirzepatide, and I'll share more about that in just a moment. But first, let's start with what GLP-1 receptor agonists actually are, because the name sounds more complicated than it is. GLP-1s are hormones that your body naturally makes after you eat. It helps with blood sugar, slows digestion, and signals fullness to your brain. GLP-1 medications mimic that hormone. Some of the brand names I'm sure you've heard of are Ozempic and Wegovy. They contain semaglutide. The other more popular ones are Mounjaro and Zepbound, which contain Tirzepatide. Tirzepatide works on GLP-1 and another hormone called GIP. These medications have been in use for over 20 years in diabetes care. What's newer is the attention they're getting for menopause-related metabolic dysfunction and stubborn weight gain. And that's where this conversation gets important. Now let's talk about what GLP-1s may actually help with. First is insulin resistance and blood sugar regulation. And for women dealing with insulin resistance, that matters because the GLP-1 may address more than one issue, not just the number on the scale. Second is visceral fat. That's the deeper abdominal fat around your organs, the kind that becomes more common after menopause. The third is satiety, because many women feel like fullness cues get weaker during this stage of life. GLP-1s help strengthen those signals, which can make eating feel more manageable. Fourth is cardiovascular risk. Some GLP-1 medications have shown heart benefits in certain high-risk groups, which matters because cardiovascular risks rise during menopause. And fifth, in some people with type 2 diabetes, these medications can help lead to remission, not a cure, remission, but still a meaningful outcome worth understanding. If that's part of your health picture, it's a conversation worth having with your provider. Now, let me share my own experience. I lost more than 50 pounds on the GLP-1 Tirzepatide, going from 187 to 130 in 6 months. Now, it's been about a year, and I still use small maintenance doses of Tirzepatide as part of my overall health plan. My doctor recommended a GLP-1 because my weight gain and rising blood pressure suggested something more was going on. And to be clear, I was already eating clean, doing resistance training 3 mornings a week, doing high-impact cardio 2 evenings a week. I was sleeping well, and I was not under unusual stress. And even with all that, my body just wasn't responding to my healthy lifestyle. My BMI stayed high. My blood pressure was rising, and I couldn't seem to lose more than 5 pounds no matter what I tried, including caloric restrictions and water fasting. The GLP-1 therapy changed all that for me. It didn't replace my habits, it just made my body more responsive to them. I had already been doing all the work for a long time, but even with my bioidentical hormone replacement therapy, my postmenopausal hormones weren't the whole story. GLP-1 therapy was the missing piece for me. And I'm sharing that because I want you to hear the real story, not just the theory. Now, before I go any further, I want to remind you about the Menopause Health Starter Kit. It includes a personal metabolic health audit, an HRT appointment guide, and a GLP-1 appointment guide with questions to bring to your healthcare provider. You'll find the link in the description below. Now, GLP-1s are not a shortcut, and they're not for everyone. The most common side effects are digestive: nausea, bloating, constipation, sometimes diarrhea, and feeling too full quickly. Some women handle these side effects well, and others don't. These medications also require medical supervision. Dose monitoring and long-term planning all matter and are required. If you have a history of thyroid cancer, of eating disorders, or if you are pregnant or trying to become pregnant, these are important things to talk through with your doctor before starting treatment. Muscle preservation is another important issue, especially for postmenopausal women. Weight loss can include muscle loss, which is why protein and resistance training matters so much. Cost and access to a GLP-1 are also real concerns since coverage varies widely. And if you stop taking a GLP-1, weight regain can happen unless the lifestyle foundations and practices are in place and maintained. So yes, they can be effective, but they're still just one tool. Now, let's talk about what GLP-1s are not. GLP-1s are not a replacement for healthy habits. They work best when they're part of a bigger overall plan that includes nutrition, movement, sleep, and follow-up care. They're not just a cosmetic tool either. For the right woman, they can be part of a real metabolic health strategy. And they're not a replacement for HRT. These treatments address things differently. For some women like me, both may be part of the plan. But for others, one may be enough. But that's a conversation for you and your doctor. Most importantly, using a GLP-1 is not a sign of failure. It's a sign that you're willing to use the right tool for the job. Now, this conversation may be especially relevant if you're in perimenopause and postmenopause and dealing with stubborn abdominal weight gain, pre-diabetes, insulin resistance, rising blood pressure, or a diagnosis of metabolic syndrome. It may also matter if you've made real lifestyle changes and you still aren't seeing the results you expect. Now, if you're considering GLP-1 therapy, bring questions to your provider appointment. Ask your doctor if you're a good candidate for a GLP-1 and what the risks are for your specific history, what side effects to watch for, how long treatment might be needed, and what the plan is for you if you stop. If your preferred provider won't have a real conversation about GLP-1s as a clinical option, consider finding another qualified provider who will. You deserve care that is informed, individualized, and respectful. Now, here's what I want you to remember. GLP-1 therapy is not for every woman, but for the right woman, it can be a legitimate, evidence-based tool for addressing insulin resistance, visceral fat, appetite regulation, blood sugar dysregulation, and cardiometabolic risks. For years, women were told to eat less and move more, even when their biology was working against them. Sometimes effort isn't the only missing piece. Sometimes the missing piece is a treatment that helps your body respond again. That doesn't make you weak. It makes you informed. Now in video 7, we're going to be talking about hormone replacement therapy, the science, the controversy, and the questions every woman should be able to ask. Now, if this video helped you, share it with another woman who may be trying to make sense of menopause, her weight gain, and metabolic health. Don't forget to subscribe, tap the notification bell, and give the video a thumbs up. Thanks for watching. I'm Kathy Bracken, and until next time, make today amazing and be well.